welcome back to Around Town with Lily. Today I'm interviewing Ruth Clay, who is the Health Director of Melrose-Wakefield. Thank you for joining me today.
Thanks for having me.
To get started, did you always know what career you wanted to pursue?
Actually, yes. I am one of those rare people that public health was what I wanted to do in college and what I studied in college. My dad was a pediatrician and my mom a medical librarian. And I did public health starting in college.
How did you become the Wakefield Health Director?
Well, that's an interesting story. That was 11 years ago. And the previous health agent was leaving. And the town was looking at alternatives, including ways of saving some money at the time. It was difficult economic times, and approached the mayor in Melrose, and actually it was Steve Mayo and the mayor at the time, Mayor Dolan, worked out something where we would share staff.
Where and what did you study to become the health director?
Well, health directors in Massachusetts come in all shapes and sizes and all different backgrounds. And some are nurses, some, especially several years ago, came from the military. There are pharmacists, all different types of backgrounds. For me, I went to Tufts that has a community health program that includes, it's actually not a major, it's a program, and you do an internship. So, I learned, basic public health in the classroom and did an internship at the state health department, and then moved to Colorado for a couple of years, and a job opened there as a local health inspector, and I applied and got the job. So that's how I learned doing inspections. It was, an inspector position, so I got a lot of good training in Colorado, and then I moved back here, which is where I'm from, to get my master's degree, and actually started out as the health director, health and human services director in Reading.
What are the main responsibilities of the health director?
The primary responsibility of the health director is basically to be kind of like the conductor of an orchestra. There's a lot of different staff. We have nurses that do things like the flu clinics. They're doing the follow-up for the COVID-19, that kind of stuff. We have staff who do substance abuse prevention and tobacco prevention. We also have inspectors who go out and do restaurant inspections and housing and respond to complaints. So, and then of course, there's managing all those parts to make sure that everything's getting done and getting done together when there's cross jurisdictions, and perhaps the inspector goes out to do a housing complaint and finds that family needs some other help, or maybe working with the school nurse on other issues that if there are kids. The director does grant writing and is always looking for grants to help with funding, and does the administrative stuff like budgets and the fun stuff.
So you just mentioned funding. How is the health department funded?
So the health department is funded through two main sources: the budget, the town's budget, which is also funded through part of the Melrose budget. For example, my position is partially funded by Melrose and partially funded by Wakefield, as are the inspectors and the public health nurse. Our substance abuse prevention coordinator is grant funded. So it's a combination of grants and the town.
How has the health department prepared for COVID?
Well, actually, we have been preparing for COVID ever since 9/11. So after 9/11, the state created some grants with money that they get from the feds. It comes to the state, then it comes down to locals. And we formed a coalition with Melrose, Malden, Medford, and Stoneham. We're the Mystic Valley coalition, and we've been receiving grant money, as I said, for many years, and we have purchased things like when the pandemic started, we already had masks. We had a lot of supplies in hand, but we also had been working on plans for an emergency dispensing site, which we used when we were doing the mask distribution. So we already had plans in place and staff who had been trained and some supplies.
Now being 6 months into COVID, was there anything you wish you could have changed going back?
Not really. I think we were well poised. It was, for public health people, not a huge surprise. We've been planning on something like this, not necessarily exactly COVID. Actually, most of the time we were planning for some kind of flu, but principles were the same. Mm-hmm. So clearly it's new, it's unusual, it's, once in 100-year kind of situation. So there was a lot of learning as we went along, but I feel like the structure was in place and the people were in place to move forward. We already had a good team that had been working together and knew each other and trusted each other. So I think things have gone actually very well.
What are a few things people can do to stop the spread?
Well, at the risk of sounding like hearing the same thing over and over again, really staying 6 feet apart and wearing a mask is just so important. It's been 6 months and everybody is tired of the rules and tired of not being able to do their daily life. And I completely understand that. I'm certainly right there with you. And it's so tempting to want to get together with people that you haven't seen in a while. But as we've seen over and over again, all it takes is one get-together, one party, and a lot of people can get sick and worse. Mm-hmm. So, hopefully, there's an end in sight. Hopefully there'll be a vaccine relatively soon. And that way, I mean like 4 to 6 months, not next month. And we'll be able to move forward. But for a lot of people, this really is a life and death situation. And even if you feel that you're healthy and if you contracted COVID-19, you would recover, that doesn't mean that the people that you are in touch with, parents, grandparents, aunts, even friends who are compromised, the consequences for them could be devastating. And we're doing really well, and we're doing really well in Wakefield, so I think it's hard to keep that in mind, because it's not, luckily, it's not right in our face right now. So it doesn't seem as urgent, and I think it's more difficult, but it's something we really, really have to do. And the public in Wakefield has done a great job, as evidenced, by our relatively low numbers.
If someone's been exposed to COVID, is there any way they can get tested?
Absolutely. Absolutely. You can get tested any day of the week. The state actually will even pay for it. It doesn't cost you anything. If you go on to mass.gov and put in the search engine "Stop the Spread," there are testing sites all over the state, 7 days a week. Sometimes you need an appointment, sometimes you don't. The closest one to us here in Wakefield is Saugus at the Square One Mall from 2 to 7, right in the parking lot. I got tested myself there last week. It was super easy, not a long line, doesn't hurt anymore. It's not like the old tests. It really just goes up an inch maybe into your nostrils and turns it, and it doesn't hurt at all. So it's super easy and super available to get tested. No reason not to, because it doesn't cost anything. It's all paid for by the state, which of course is a cost ultimately to us.
I know flu season's also coming up. So is there anywhere in town you can get tested for the flu, and do you recommend getting tested or the vaccine?
Vaccine. So we're not testing for flu yet, but we will be. And yes, we are doing flu clinics. They will look different this year because everything is different this year. We're going to be doing a drive-through clinic in front of the high school. We haven't set a date because we don't physically have the vaccine, and there have been some small delays in shipment with the vaccine, so we don't want to give a date and then not have the vaccine. So, but the beginning of October, we're anticipating having a drive-through. We're also having our pop-up clinic that we have every year at the farmers market on the 26th, 9 to 1, adults. So people can come by. The form can be filled out in advance. It's on the town's website in the health department section. You can fill it out in advance and bring it with your health insurance card and hopefully short sleeves with a coat over it. But if you don't have to fill out the paperwork in advance, you can come down, and we take all insurances except for United Healthcare and Aetna. So there is September 26th, and then drive-through the beginning of October. And then we're also planning to doing another thing that's different this year. We're going to be holding family clinics where the whole family can come down and get immunized at the same time. So you don't need to make separate appointments somewhere for your kids and a separate appointment for yourself. You can do it all together. And again, we're waiting. That's vaccine that's provided by the state health department, and we're waiting till the beginning of October to be told how much vaccine will be given and when. So definitely keep your eye on social media and the town's website, and as soon as we have dates, we will definitely put them out there.
So schools are reopening soon. If a student comes down with COVID, what is the plan?
So the plan is if a student is positive, they would follow the same rules as we've been following since March, which is they are isolated for 10 days at home. They don't leave home. They preferably stay isolated from the rest of their family if you have a house that you can do that. And they can return to school after 10 days as long as they haven't had a fever for 24 hours with no fever-reducing medication and their other symptoms are dissipating. So, and that's the same for teachers, staff, students, anybody. That's how that will be handled. If they are a close contact of somebody who's positive, so perhaps somebody in their family is positive, so they would be considered a close contact, then they stay home for 14 days and then return after 14 days. Even if they test negative, they still stay home and quarantine for 14 days.
Going back to school, students are now required to wear a mask. Is there any mask that should be more preferred than the others?
Yes. Yes, there are actually. A mask that is tight-fitting and has 2 or 3 layers is what we are recommending.
What will be one of the first things you do to enjoy yourself once we overcome COVID?
Travel. Travel. I had a lot of travel plans that were canceled this year. So I've been doing some camping in New England this summer, but travel, definitely.
What are some things you've been doing to keep busy during COVID?
Well, COVID has pretty much kept me very busy 24/7, but what I normally like to do is I do quilting, and miniatures is a big hobby of mine. So I make small things for doll houses, and I knit and I make quilts.
Okay, well, thank you for joining me here today.
It was entirely my pleasure.
Thank you. Thank you for watching. I encourage you to wear a mask, and I'll see you next time on Around Town with Lily.